clavicular as well. The shoulder separation is an injury in which you have a dislocation of the shoulder joint due to tearing or stretching of any of these ligaments. These are the muscles that give strength to the shoulder: the supraspinatus, infraspinatus, subscapularis, and teres minor. These four muscles are the major muscles that allow you to throw and move the shoulder in all the jointal positions it can be in. Let's look at it here. In this picture, you can see the ligaments. Stop this video and watch and learn for a few seconds, please. Here now. Okay, welcome back. I hope you have studied the ligaments and the positioning of the humeral head into the glenoid cavity here. This is another view of the shoulder joint from a sagittal lateral view. Take note where everything is located, and let's look at the glenoid cavity. The glenoid labrum is this fibrocartilaginous tissue that helps absorb the shock between the bone of the scapula and to the head of the humerus. Plays much like the meniscus of the knee, but for the shoulder. The elbow joint is a stable hinge joint. It articulates with the humerus, the radius, and the ulna. Its main motion is flexion and extension. It can also do somewhat of a little bit of circumduction and rotation, but it's limited. The articulation of the elbow. It does allow the largest articulation other than the shoulder. It is connected to the humerus and the ulna. It does, however, have limited movement because it only really goes flexion and extension. Here we have it, the side view of the elbow. What supports your elbow? The biceps are attached to the radius and they help the elbow in motion. Along with the biceps, you have ligaments at the elbow. There's the radial collateral, the annular, and the ulnar collateral. Of these three elbow ligaments, the third one, ulnar collateral, is possibly the most overused ligament. This occurs in baseball and football players when they throw the ball forward. Baseball players manipulate and stretch that ligament farther than any other human being. It is not a normal motion, and when baseball players tear the ulnar collateral ligament, their season is done, perhaps their career if it's that bad, and it requires surgery and months of physical therapy. It is also known as Tommy John surgery. Here we have it. Pause this video and take a look at all the ligaments here. Okay, welcome back. Let us move on. The hip joint is known as the coxal joint. It is a ball and socket diarthrosis, somewhat like the shoulder, but it's a little bit more limited. It's got a wide range of motion though. The structures of the hip joint include the head of the femurus. It inserts into what's called the acetabulum. The acetabulum is a circular dip or a connecting part of the hip for the femur. Again, this is connected by the labrum of the acetabulum. Take a look at this picture. You can see all the ligaments here and how it attaches the femur to the inside of the hip. Now, as you look here, the pubifemoral ligament is covering the actual head of the femur and the neck. The femoral head is deep inside the socket, which you cannot see here. Moving on, the knee joint is the most complicated hinge joint. It transfers weight from the femur to the tibia, articulation of the knee, and there's basically two femoral tibial articulations at the medial and lateral condyle. There's also one between the patella and the patella surface of the femur. Now, what does this all mean in English is this. Your knee is the most abused joint of the body. I would say more than your shoulder. Why? Because the knee absorbs all the weight from the upper body 100% of the time when you're on your feet. You don't walk on your shoulders. You walk on your feet, but the force is all transferred at the knee joint. You have inside the knee the medial and the lateral meniscus. These are fibrocartilaginous pads that cushion and stabilize that knee joint, preventing bone-on-bone action or arthritis. As you get older, the meniscus does leak the fluid, and some people need total knee replacement such at a time when you have no cushion in between the bones. The patellar ligament is what holds the kneecap in place. You also have serious injury to the knee when you tear something called the ACL, known as for the anterior cruciate ligament. It is the most important ligament of the knee, especially if you're an athlete, because when the ACL tears, you do not have the ability to cut left and right. If a football player needs to move left and right to avoid a tackle, he cannot do that anymore. Number 6 and 7 are known as the MCL and the LCL. These are ligaments that stabilize your knee joint from the inside and the outside. Take a look at this picture. This is a picture of a gross anatomical view of a true bone from a cadaver. You can see where the ACL is. It's inside the actual intercondylar fossa of the condyle of the femur. You can see the attachment of the left side of the tibial collateral ligament, which is the MCL, and the lateral ligament on the outside, known as the fibular collateral ligament, we call it the LCL. The head of the fibula attaches ligaments as well, and the most important thing of this, other than the ACL, as you can see here, is the lateral and the medial meniscus. Look at that fibrocartilaginous white pad. It looks like egg white. That's just sitting in between the two bones of the tibia and the femur, and it absorbs 100% of all the force when you're walking and running. This is the posterior view, and as you can see, the meniscus, it's usually thicker medially than it is laterally. Okay, the following graphs are going to demonstrate or explain to you the actual type of articulation and the movements that occur at the joints. Please take some time and study these graphs starting now. Alright, welcome back. Different types of effects as you age on the bone joints. Rheumatism is a pain that stiffens your skeletal and muscular system, such as rheumatoid arthritis. Arthritis is any form of rheumatism that damages your joints and cartilages and the synovial joints. It's just a pain that occurs when the ligaments or the cartilage starts to diminish and you have bone on bone rubbing. That's quite painful. Osteoarthritis is caused by the wear and tear of joint surfaces or genetic factors. Generally, arthritis occurs when you're older, let's say over the age of 60. Keep in mind, rheumatoid arthritis is the worst arthritis of all because it attacks your immune system. Here we go. Rheumatoid arthritis. It is an inflammatory condition, involves the immune system, like I said before, and it can be caused by an infection, allergy, or just your body getting old. A gout or gouty arthritis occurs when crystals form. This is painful. This is when uric acid or calcium salts occur inside the skeletal system and you have growth of solid rocks kind of crystallizing in between the joints. It is forming within the fluid that's supposed to help cushion. So the fluid becomes hardened, and it occurs due to metabolic disorders of the body. Joint immobilization reduces any movement of your synovial fluid. This can cause basic arthritis, and you can treat this by something called CPM or physical therapy, in which you have constant motion of the joints by a physical therapist. Bones and aging. As you age, your bone mass decreases. Your bones weaken and they become brittle. The increase of risk of a hip fracture, hip dislocation, or pelvic fracture is more increased. And it happens among elderly people, especially elderly women, because of osteoporosis and the menstrual cycle. Bone recycling occurs when living bones maintain some type of homeostasis between bone building of the osteoblasts and the bone breaking of the osteoclasts. Equilibrium is much better than not having enough of one of the other. Factors affecting bone strength, as we said, is number one, as you get older, physical stress on your body and joints, the number of hormone levels that decrease as you age, the calcium and the phosphorus uptake and excretion. That means basically you're not getting enough the food and mineral deposited into your body as you once were as you were getting older. Number five, genetic and environmental factors. As you get older, cancer increases inside, believe it or not, the bones, as well as the rest of the body systems. Environmental factors, depending on where you live, if you're living around smoke and very bad living conditions. Bones, in general, as we finish this, remember that your bones basically support and protect other systems. Your thoracic cage protects your heart and your lungs. They also help to store a little bit of fat, mostly calcium and phosphorus, though. And what is the most important thing other than structure and movement, I would say, is the manufacturing of blood cells. Your bone marrow is quite important for helping you maintain a healthy immune system. If not, as you get older, disorders do form. You have tumors in your bone, like I said, osteoporosis, weakening of the bones, arthritis when bones begin to rub on each other. Rickets forms when bone becomes weak and they bend because you don't get enough vitamin D absorbed anymore. And that ends our Chapter 9 discussion, and I will see you in class where we'll discuss this more. Thank you for listening.